Dentistry, transforming your health for a lifetime.
Welcome to Complete Health with Dr. Mike Rogers. I'm April, your host. Joining me today is Dr. Mike Rogers to discuss 3 big events going on. Good morning, Dr. Rogers.
Good morning, April, and good morning, Northeast Pennsylvania.
The first thing going on this month is National Children's Dental Health Month. I know you have a lot to talk about with our listeners. Can you start with why you chose this topic for today's discussion?
I chose this topic because cavities are very common in children. They are 5 times more common than asthma, 7 times more common than hay fever, and are more common than type 2 diabetes and obesity. The CDC, Center for Disease Control, reports that 42% of children aged 2 to 11 have untreated cavities.
Wow, that's staggering.
It sure is.
Can you briefly tell our listeners what decay and cavities are?
Well, decay and cavities are soft spots or holes in our teeth that are caused by the bacteria in the mouth using the foods that we eat and drink.
How does decay and cavities affect a child?
Well, decay and cavities can affect children's oral health by causing infections, pain, discomfort, swelling, and loss of teeth.
That's a lot.
It is. These problems can affect their overall health. Infection caused by decay and cavities can travel throughout the body and cause many medical issues.
That's something that not many people realize.
Exactly.
And I know you're very passionate about making sure that is understood.
Exactly. And that goes back to what we call the oral systemic connection, how the mouth and the body is all connected. Loss of teeth due to decay and cavities can cause many issues such as crowding, speech issues, the inability to chew food properly, and therefore affecting a child's digestion. Areas of decay can be unsightly and may even cause self-esteem issues. It can cause difficulty in speech, affect academic performance, and it's estimated that over 51 million school hours are lost every year due to dental-related issues.
Wow, that's a lot.
It sure is.
So, Dr. Rogers, how do you suggest our listeners teach their children or grandchildren to take care of their teeth?
Well, kids should brush everybody should brush at least twice a day, after breakfast and before bedtime. If they can, children should also brush after lunch or snacks. Proper brushing breaks down the plaque and prevents cavities.
I know I've seen a saying that you brush your teeth in the morning to keep your friends, and you brush your teeth at night to keep your teeth, correct?
I never heard that one, but thanks for it. Children should brush all of their teeth, not just the front ones, and they need to brush all the surfaces of their teeth, along the outside, along the inside by their tongue, and the biting surfaces. They should take their time brushing 2 to 3 minutes each time they brush. And if you have a tendency to lose track of time, use a timer or play or sing a song that you like.
Oh, they would never lose track of time.
The other thing they need to do is also keep in mind they should brush their tongue.
And we give out Firefly toothbrushes that have a built-in timer. I love these toothbrushes. They blink, they light up while you brush, and they stay blinking for 2 minutes. And then we also give our child patients a 3-minute hourglass sand timer, and that helps them maintain that 2 to 3 minute brushing habit. Now, another question that we get a lot from parents is, how much toothpaste do you recommend a child put on their toothbrush?
What I recommend for children up to the age of 3 should use the amount, say, equal to the size of a grain of rice. Children over 3 should use a pea-size amount.
Okay. I see a lot of people covering all of their bristles, so that's very helpful.
It sure
Size
is.
of a grain of rice for a little one. Okay.
Yes. Use a soft bristle brush and change every 3 months.
What about if they've been sick and it hasn't been 3 months?
Then you should change it after that because bacteria can get caught in that toothbrush.
So you're just reinfecting yourself, and if you have a child that's just constantly sick and it keeps coming back, that could be one reason why. So
exactly.
make sure you throw that toothbrush out and get a new one.
Mm-hmm.
At what age can children brush by themselves?
You may find this surprising, but children do not have the manual dexterity to properly brush until the age about 8. Parents
That's
should
much older than I would have expected it.
Yeah, parents should really be assisting or helping and supervising the brushing to be making sure that it's done properly and to avoid surprise cavities at their dental visits. Children also should learn how to floss their teeth to remove the food from between their teeth. So once the teeth become in contact, regardless of age, we should start flossing their teeth. Make sure they brush their tongue and the roof of their mouth, as we talked about earlier.
And what's your opinion on a tongue scraper?
If you can get them in the habit of that, that's wonderful.
Okay. Do you have any recommendations along with good brushing habits that would prevent tooth decay?
Yes, don't share eating utensils, forks and spoons, drinks, or blow on your children's food. Clean off a pacifier by putting it in your mouth.
Why is that?
Well, the bacteria that we have in our mouths, now when you blow on a food or you share utensils or drinks or things like that, you're actually putting that bacteria into your child. So you're actually inoculating your children with your bacteria. And so as we discussed later, we're going to see how all of that plays a part in the overall health of the person. So you're starting real early, hitting children with bacteria that they've got to now fight the rest of their lives.
I never thought of that. That is pretty gross, and I am very guilty of the pacifier thing. If it fell, cleaning it off in my own mouth. Wow.
And one other thing that I want to just bring up is that studies show that cavity-causing bacteria are actually found within the placenta and in the amniotic fluid inside a mother's womb. So during pregnancy, moms should really, really be consistent on taking care of their health because it can affect children in utero.
Wow. And at what age do you recommend that the children see the dentist?
I recommend your child's first dental visit by the age of 1. And following the first visit, children should be seen by a dentist every 6 months. Eating a healthy, balanced diet includes fruits, vegetables, avoiding sugary foods and drinks and highly carbonated and prepackaged foods. Use a fluoridated toothpaste. Have sealants placed on back teeth or permanent teeth to prevent decay on the biting surfaces.
Doctor, I want to go back to your statement about children should be seen by their dentist every 6 months. Can you take our listeners through a typical dental appointment?
Sure. For children ages 1 to 3, I examine your child for areas of decay, plaque, areas where they may be missing, brushing, soft tissue concerns such as tongue tie. I discuss with the parents how to maintain the health of their newly erupting teeth, and we clean the child's teeth. For children over 3, we examine areas for decay, plaque, and soft tissue concerns, as well as we screen for oral bacteria, meaning the bacteria in the mouth. We evaluate the tooth position and how teeth are coming in to make sure there's enough room. We evaluate airway for problems and sleep apneas.
What does that have to do with dentistry?
Well, it does a lot because crooked teeth, crowded teeth, and things like that are actually a symptom of an underlying airway or breathing or sleep problem in a child. And that all can contribute to ADHD, night terrors, bedwetting, all that. And you can look up more or hear more about that going to our podcasts on our website.
Complete Health Dentistry of NEPA.com. So, doctor, are you saying that you check children for braces at age 3? Isn't that a little young?
Well, no, it's not, because we want to catch children early, and we can do interceptive myofunctional, meaning muscle exercising things early and help correct airway problems and get their teeth repositioned a lot of times without even using braces.
What else is done at a dental visit for children over 3?
I teach proper brushing and flossing techniques, and then we clean their teeth and recommend sealants on back erupted molars and premolars or bicuspids.
And of course, at the end of the appointment, there's always a discussion with parents on how well their child did, and then a trip to our treasure chest. So to schedule your child's wellness visit, or if you have any concerns about their dental health, call our office at 570-253-5000.
When we come back, I'm going to tie in Children's Dental Health Month and how starting healthy habits early can help prevent the number one killer of adults in the United States.
Are you looking to improve your health? Your smile? Tired of being tired? Are you out of shape or overweight? Or are you suffering from chronic medical issues with no solutions in sight? Or do you just want to get healthy and stay healthy? Well, we have a solution for you. Join Complete Health Dentistry, Revolutionary Health Practices, Cole's Gym, and Lynn's Healing Zone for a chance to win a New Year Healthy You transformation. This includes a complete dental and medical evaluation with an individual plan to improve your overall health over the next 6 months at no charge to you. Visit our website at CompleteHealthDentistry.com for more information and to fill out your application. Deadline to submit is 5 p.m. February 20th, 2019.
Clean Health Dentistry, transforming your health for a lifetime.
Welcome back to Complete Health with Dr. Mike Rogers. Dr. Rogers, before the break, you made a very profound statement, and you've now piqued our curiosity. Can you start by telling us what the number one killer in the U.S. is, and why are we discussing it on today's show?
Well, April, the number one killer of Americans in the U.S. is heart attacks. And in women, lots of times this is overlooked because their first major vascular event is usually fatal.
Oh, that's frightening.
Heart attacks and strokes, other vascular issues, most times are completely optional.
What do you mean by optional?
I mean, they can be prevented. And this month, during Heart Health Month, I feel strongly about the connection between the mouth and the body and heart attacks, which are truly, truly preventable. And that's why I want to spend this segment talking about, with our listeners, the prevention of this deadly disease.
What are the risk factors for heart attack?
There's a lot. Poor oral and dental health, high blood pressure, high cholesterol, unhealthy lifestyle, being overweight or obese, diabetes and prediabetes, smoking, physical inactivity, genetics, a history of preeclampsia during pregnancy, unhealthy diet, and being over 55.
That is a lot. Wow. Does heart disease only happen in those over 55?
Actually, no. It's happening in younger adults more frequently because the conditions leading to heart disease are occurring at a younger age. High blood pressure, increased obesity, health of the gums and the mouth all increase the risk of people between 35 and 64 and increasing the likelihood of heart disease earlier on. Half of the Americans have at least one of the top 3 risk factors of heart disease.
Now, you stated poor oral and dental health is a major risk factor for heart attacks. Can you explain that?
Sure. Dental infections, pathogenic oral bacteria, and failing root canals are now known to cause heart attacks. Studies published in peer-reviewed medical journals showed irrefutably that at least 5 types of pathogenic or bad periodontal or gum bacteria are the cause of heart attacks.
How does that occur?
Well, the root cause is systemic inflammation, and the studies show that these bacteria are able to worm their way into our bloodstream, increasing the severity of our body's inflammatory process and systemic inflammation. In areas where the arterial walls are breached, a clot that is formed and obstructs the blood flow of the heart or brain.
And that's the difference between a heart attack and a stroke, right?
Correct.
Are there any other dental issues that can cause a heart attack or stroke?
Yes, dental infections in the mouth from an abscessed tooth or a failing root canal. There was a study published in the American Heart Association's journal called Circulation showing that almost 80%, that's 80% of the clots contained the bacteria from that dental abscess.
Wow, doctor, that's significant.
Well, April, the significance of these studies show that 50% of heart attacks and strokes are triggered or caused by the bacteria in our mouth.
Holy cow, 50%? So that means that at least 50% of all heart attacks and strokes can be prevented by proper dental care at home and seeing your dentist for a cleaning.
Well, wait, I didn't say that. There's a lot of factors that play into this. And questions you should ask yourself. Do your gums bleed when you brush or floss? Keep in mind that people who smoke will have less bleeding.
Does that mean they're healthy?
Well, no. Smoking or nicotine constricts the blood vessels, so the lack of bleeding can be misleading to a smoker. Are there tooth infections in your mouth? Was your plaque or saliva screened or tested for these heart attack or stroke-causing bacteria? If the answer to the first two questions is yes, and the third question is no, then you need to get into our office, especially if you have risk factors or family history of heart disease.
What is the treatment for it?
The treatment is to eliminate the bacteria in your mouth, and this will then prevent the bacteria, like I said, from worming into your bloodstream.
Is this a one-time thing? And how is it done? Do you do surgery?
Most of our patients do not need any surgery. It's just we go in and we eliminate the bacteria non-surgically. But it's a partnership between us and the patient. The patient has to do a lot more than just brush their teeth once or twice a day in order to keep the bacteria at bay.
So it's a partnership with the patient in their home care along with more frequent dental visits?
Yes.
Okay. I understand insurance only pays for 2 cleanings a year. Isn't that enough?
Well, the 2 cleanings a year actually was created by a toothpaste company back in the 50s, and insurance companies have followed that general recommendation. At my practice, I tailor the appointments and the frequency of them and how we treat your dental condition to your individual needs. You know, within 90 days or 3 months, the bacteria has regrown to full capacity again.
That's nasty. All those bad bacteria are growing in my mouth all the time?
They sure are.
We're almost out of time, Doctor. Do you have any more tips for a healthy start?
I sure do. Stop smoking. Know your numbers, weight, blood pressure, and cholesterol numbers. Screen for diabetes. Get active. Build some muscle. Eat heart-healthy diet. Limit junk foods and sugar. Reduce stress. Sleep more. Take care of your mouth and eliminate the bacteria. And the biggie is smile.
And I'm doing that right now because when we come back, we will be discussing the exciting details of our New Year Healthy You Transformation Contest. Stay tuned to see how you can become this year's Complete Health Butterfly.
February is American Heart Month. Heart disease is the leading cause of death for both men and women. To prevent heart disease and increase awareness of its effects, Complete Health Dentistry of Northeastern Pennsylvania is proudly participating in American Heart Month. Medical studies have shown that up to 50% of all heart attacks are caused by inflammation in the mouth. To lower your risk, Dr. Rogers recommends you brush and floss daily, regular dental visits, see your dentist immediately for bleeding gums, quit smoking and stay away from secondhand smoke, control cholesterol, blood pressure, minimal alcohol, get active, eat healthy, and watch your weight. Dr. Michael Rogers, supporting healthier communities and healthier lives. Call 570-253-5000 and begin your path to better heart health.
Complete Health Dentistry. Transforming your health for a lifetime.
New patients are always welcome.
Welcome back to Complete Health with Dr. Mike Rogers. Are you dreaming of living a healthier life? Well, dream no more. Complete Health Dentistry of NEPA has teamed up with Bold Gold Media, Dr. Charles Whitney, Lynn Wright's The Healing Zone, Cole's Aerobics and Fitness Center, and Apple Day Spa to help one lucky winner get healthy.
I have invited several sponsors on today's show to discuss what their role will be in this amazing transformation. Let me introduce you to our first guest this morning, Dr. Chip Whitney. He will be the physician overseeing this transformation. Good morning, Chip.
Good morning, Mike. Good to talk to you.
Good morning, Chip.
Chip, can you tell our listeners a little bit about yourself and your business and how it ties into the complete health philosophy?
Well, the complete health philosophy is actually what I do every day. I do transformations every day of my career. I'm a family physician, trained in the Air Force, and everything I've done is aimed around empowering a motivated person to transform their health into the future they imagined. Everybody has that 80th birthday, pick an age that they expect. Unfortunately, far too few people reach their goals, and my goal is to meet that person where they are, sort out the root causes of things that are going on, and basically identify what changes are needed to be made and then empower them to do so.
Awesome. That sounds great.
What made you decide to join us in sponsoring the New Year Healthy You Transformation Contest?
Well, actually, it was quite easy. I've known Mike, and just the passion that he has for his role in complete health, and I'm same heart, different specialty. So that made it quite easy. And as I said, transformations is what I do every day of my life. So this was an easy decision.
I like that. Same heart, different specialty.
Yes, very true.
Can you give us a glimpse into what treatments the winner will receive from you and how you hope it will transform their lives for the better?
Sure. Well, one of the things I like about your program is you're bringing together a team of people to help them transform, which is imperative. I mean, a physician can only do so much. So if they want the details, they could take a look at my website, which it lays it out under the RHS approach section. It's rhslivewell.com, but basically they can expect to have a detailed questionnaire to kind of find out where their risks lie, where are their family histories, do we need to talk about preventing dementia, do we need to prevent heart attacks and strokes, is cancer the big deal, are they prone to toxicity? So we kind of dive into who they are and find out what the needs are, because you can't do everything. So we really sort of what their personal motivators are and what their needs are. And then we do a detailed lab analysis on beyond some of the things that they would normally have at their physical, and sit down and have an overview of everything to kind of show them what path they're on. They'll see on my website I have a map right on the homepage where basically everybody's on a path to a future. We just have to know, is that a good path or is that a bad path? And what I'm able to do is just through past history and current status of all their testing, get an idea of what path they're on and how they can change their past for the better.
And now, Chip, it's very important for our listeners to know if they're thinking about this contest and saying, well, I'm not sick, it's not for me. We want everybody to know that it's not necessarily for someone who's very sick. It's also someone who may have a family history and they're concerned about what lies ahead in their future and they want to be preventive.
Yeah, absolutely. The core need for the winner is to be motivated, because they're going to be offered a team of people that can coach them. I will be the medical coach. Others will be fitness coaches, maybe nutritional other things like that. But if they have a motivation to make their future the future they want to be, now is the time to start. I always use the example of dementia, which they won't see a lot on the website about that, but I'm unveiling that this year. But you have to begin preventing dementia decades before you get dementia, because those wheels are churning long before anybody starts losing their mind. So, yeah, it's not about being not sick. Many of us think that we're healthy, and they say, "Oh, I'm healthy." Well, you've not had any disease yet. But you're in that not sick phase where your blood sugar is a little high, your cholesterol's a little high, your blood pressure is a little high, you got some bleeding when you brush your teeth and floss, and that doesn't mean you're healthy. It means you're just not sick. ... yet. But this is what we're looking to prevent, is ever getting to that point. The winner is the winner. Find that one fortunate person that gets to show the world, show your other listeners what's possible. Because some people don't realize what's possible in preventive medicine. A lot of what I do, people have never heard of before. So our goal is to not just show that one person what's possible, but let that person be the one that kind of enlightens all your other listeners about complete health.
Chip, thank you very much for joining us today, and we look forward, like we said, working together closely to help the winner move on to a long, healthy lifestyle. Now I'd like to introduce our next guest, Lynn Wright of the Healing Zone in Hawley. Lynn, can you tell our listeners a little bit about your business and how it ties into the complete health philosophy?
I'd be happy to, Mike. The Healing Zone is all about helping people achieve optimal health physically, emotionally, mentally, and spiritually. And we have a lot of modalities that help with that. We have nutritional microscopy, which looks at a little finger stick of blood under a microscope, and the picture is projected onto a TV screen, so people actually get to see their blood. And it's a great learning tool. It makes it much better for patient compliance because people can see the changes when they come back again for rechecks. We do light therapy, which is great for skin conditions like acne and healing broken bones, and wound healing, all kinds of things, even seasonal affective disorder. We do bioterrain auditing, which is looking at samples of urine and saliva, and that tells us a lot about someone's digestive capacity, how well their kidneys are working or not working, if their autonomic nervous system is balanced or imbalanced. It's a lot of information. We basically are very much into treating things naturally through nutrition and lifestyle changes.
Sounds like you're very like-minded with what we're doing. I love that. What made you decide to join us in sponsoring the New Year Healthy You Transformation Contest?
I think it would be really exciting to see someone who has a lot of needs for improving their health and watching them change over the course of 6 months and learning how much control they do have over their own health. People don't think that they have much control. They feel that their doctors need to tell them what to do every step of the way. And once you learn to listen to your body and get in tune with what it's telling you through nutrition and lifestyle and proper medical management, people can really get a handle on acute medical issues and chronic medical issues and deal with them much more effectively.
Love it. Can you give us a glimpse into what treatments the winner will receive from you and how you hope it will transform their lives for the better?
Yes. The nutritional microscopy, like I said, is a great learning tool because people actually see their blood live on a screen. They see their red blood cells and their white blood cells. And one of the biggest differences between looking at blood live and looking at it when you've had it drawn is that when you have blood drawn, if you ever look at the tubes, there's always like a jelly or a fixative in the bottom of the tube. And the first thing that happens with your blood is it gets killed, because you can't do cell counts with blood that's moving around. But that doesn't really let you see how all the components of blood work together. And then they centrifuge the blood, they spin it out, and they separate red cells, white cells, platelets, so you don't see how everything works together. So for example, you can find out that your neutrophil count, and neutrophils are the white blood cells that act like little vacuum cleaners. They travel around in the blood, eating up bacteria and viruses. And in traditional blood tests, they'll tell you what your count is. But if they're not moving, if they're not working, then it's like not having enough. So ideally, medicine used to do both, but now we primarily concern ourselves with blood tests done by a lab. But you can learn so much more interactively with the microscopy. Same with the bioterrain, where we're looking at samples of urine and saliva. It's a great educational tool, and it's all about educating people. As a certified naturopath, I do not diagnose and I do not treat. I educate people and I help them take control of their health. A lot of it relates to diet. Most people know that GMOs are not healthy, but there are so many other things you really need to know about the food that you're eating, where it comes from, when to eat it, what's in it that maybe shouldn't be in it. Grocery shopping can be a huge issue. So if the person who wins the contest would like, we would love to take them on what we call a guided shopping trip.
Awesome.
Yeah, we go to a grocery store and we show them basically what you do want to put in the cart and what you want to leave on the shelf.
Lynn, thank you very much for coming in today. I want to thank you and Dr. Whitney today for coming in and discussing these options with our listeners.
It's a pleasure, and I can't wait to meet the winner and help them on their road to wellness.
To fill out an application, go to Complete Health Dentistry of NEPA.com and click on the New Year Healthy You icon.
Complete Health Dentistry, transforming your health.